So now friends, I want to discuss with you what is KLex. If you go on social media, or probably you must have heard from your friends this term. What exactly is KLex? So KLex is the nomenclature which stands for Kerato-Lenticule Extraction. Kerato means cornea, lenticule means a small part of the cornea or a small lenticule, and EX means extraction. So basically, if we imagine this is the cornea or the outermost part of the eye, जिसको हम हिंदी में काली पुतली भी कहते हैं, इसमें से only one type of laser used, a femtosecond laser. So such a laser will make a small lenticule inside the cornea, and with a small incision of only 3 millimeters, this lenticule is then removed. So majorly our cornea is untouched. So there is no damage, there is no less damage to the nerves compared to a LASIK procedure. So this is the term that is used by the International Society of Refractive Surgeons, known as KLex. So there are different types of machines that do the KLex procedure. You might get confused with कौन सी machine कौन सी surgery करती है, surgery का नाम क्या है. Of course, for us ophthalmologists, we know the fraternity, so we know it is easy for us. But for you as patients or probably relatives, it is difficult to understand कौन सी machine कौन सी surgery कर रही है. So let me just break it down for you. As of now, commercially, only 4 types of KLex procedures are there in the market. Smile, then we have silk, then we have the clear, and we have the smart sight. So as of now, there are only 4 platforms that can do KLex that are available commercially. So firstly, Smile is by a German company Zeiss. Silk is by an American company Johnson & Johnson. Clear is by a Swiss company Zimmer, and Smart Sight is by Schwint. So today I would also like to bust some myths that are commonly floating around social media and among patients about silk procedure and flap based procedures. So we all know that there are 2 basic types of procedures. One is a flap based procedure known as a LASIK. LASIK stands for laser in situ keratomileusis, and the non-flap based procedure, which is also known as KLex. So I'll just give you a brief overview that refractive surgery is basically of 2 types. One is LASIK, as we all know, laser in situ keratomileusis, and the other is popularly known as KLex. KLex stands for Kerato-Lenticule Extraction. That is, in a LASIK procedure, we are making a flap on the cornea, but a KLex procedure does not have a flap. So if this is the cornea or the outermost layer of the eye, in the LASIK procedure, we are firing a laser and we are making a flap on the cornea. And this flap is later just picked up. So this flap is picked up, and then a laser is fired to remove part of the cornea to remove the power. But in a KLex procedure, if this is the cornea, we are not firing a laser and making a flap on the cornea. We are making a simple lenticule inside the cornea, and this is then just removed through a very small incision. That's it. So this KLex was started in 2008 by a surgery known as Smile, by a company called Zeiss, and then later into the market more machines have been launched. One of them is Silk. Silk stands for Smooth Incision Lenticule Keratomileusis, which is by an American company Johnson & Johnson. So the basic difference between the LASIK and the KLex, or also the Silk procedure. So if I compare the LASIK and the Silk, what is very important to note is that in the LASIK procedure, we require 2 different types of machines. With one machine, I will form the flap, which is picked up, and with the second machine, with the second laser, I am going to fire one more laser to remove part of this tissue. And once this tissue is removed, this flap is put back. So you must understand that this flap, once it is lifted and it is put back, it does not adhere very well. Let's say you're into contact sports, if you play basketball, football, judo, karate, or probably boxing, and something hits your eye, this flap can actually get dislodged. अगर जोर से चोट लगे तो ये flap जगह से हिल सकता है. So you have to come back to your ophthalmologist and they have to place the flap back. So there are certain flap-based complications that occur only in a LASIK procedure. All these complications are not there in the silk procedure. Why? Because there is no flap on the cornea. And also, what is very advantageous in the silk procedure, only one type of laser is required. Only one type of laser will form this lenticule inside the cornea, and with a very small incision, this lenticule is removed. So it is very, very easy. It's similar to having an open abdomen surgery versus having a laparoscopic surgery. In earlier days, when we had an open abdomen surgery, a big cut was made on the abdomen and the gallbladder was removed. But now in modern world, we have a laparoscopic surgery where through a small port of 3 millimeters, the gallbladder can be removed. Similarly, we can compare the LASIK and the silk procedure, where a cut, this laser cut is 22 millimeters, while the cut in the silk is just 3 millimeters. There is a difference of 1/7, 7 times larger in the LASIK procedure. So friends, today I want to give you a brief comparison of the KLex or the silk procedure vis-a-vis that of the ICL or the implantable Collamer lens. So we need to know what exactly these procedures are. So if we imagine that this is the outermost layer or the cornea, and this is the eyeball. This is the natural lens inside the eye, and this is the brown part of the eye also, which we call as the iris. This is the brown pigmented part, and this small hole is called the pupil, from which the light enters inside the eye. So we need to understand that in a KLex procedure, what we are doing is essentially we are making a small femtosecond lenticule inside the cornea, and this is then removed from a 3 millimeter incision. And once this is removed, the glasses are removed. But in an ICL procedure, implantable Collamer lens, a lens is placed here inside the eye. So the ICL procedure is reserved, as of now, the ICL procedure is reserved for patients who have a very, very high power or whose corneas are very thin. Why? Because we can reduce the thickness. इस cornea को हम एक limit तक ही पतला कर सकते हैं. KLex procedure या silk procedure करने के लिए हमें cornea का thickness कम करना पड़ता है. So we can reduce this thickness only up to a certain threshold. Beyond that, we cannot. If we do, then yes, the cornea can have some weakness in future. To avoid that, we do an ICL procedure. But we must know when to use an ICL and when to advise the KLex procedure. Only your ophthalmologist or refractive surgeon will be able to tell you correctly what surgery is correct for you.
Follow Planet Lasik and post your queries to get answers from the experts.